into Medicare Basics, sponsored by Hoag Hospital and the Hoag Medical Group. The Hoag Medical Group is an excellent team of doctors that provide internal medicine, family practitioners, and they have a team of over 48 specialists treating over 350 specialists. And my name is Derek Tarvin, and I've had the honor and privilege of working as the outside insurance consultant for Hoag Hospital for over 25 years. We have a family business, and we have an office in Costa Mesa. We are independent brokers and represent all different plans and companies, and we counsel everybody on all aspects of Medicare, Medicare options. We can help review your current group or individual policy and compare that to your individual Medicare options. We never charge a fee for consultation or help anybody enroll into insurance. And today we'll be going over what is Medicare, signing up or enrolling into Medicare, the two main choices for Medicare plan coverage, which can be a Medicare Advantage, which can be a Medicare Advantage HMO or Medicare Advantage PPO. We'll be discussing the Medicare supplements, also known as Medigap policies, the Medicare Part D, which is your prescription drug coverage, extra help, and various enrollment timeframes. So first of all, what is Medicare? Medicare, also called Original Medicare, is health insurance for persons that are age 65 or older, or any under age 65 that have received disability benefits for more than 24 months, or any age persons that have end-stage renal disease or Lou Gehrig's disease. Medicare has four different parts. Part A, which is your inpatient services. Part B, which is all of your outpatient and medical services. Part C, which is considered the Medicare Advantage HMOs and Medicare Advantage PPOs. And then the Part D, which is considered your Part D prescription drug coverage. Only Medicare Parts A and Part B will ever appear on your red, white, and blue Medicare card. And there is an example there on your screen. So Medicare Part A, this is your inpatient hospital coverage. Most do not pay a premium for Medicare Part A. It was paid by you or your spouse through payroll taxes while working. And it helps cover inpatient care in hospitals, skilled level of nursing care in nursing facilities, hospice, limited part-time medically necessary home health care, and more. So Part B of Medicare, this is your medical and outpatient coverage. Most do pay a premium for Part B of Medicare. The standard premium for Part B of Medicare this year is $144.60 per month, but it can be more depending on your income. The premium for Part B is deducted from your Social Security benefit if you're drawing it, or you'll receive a quarterly bill in the mail until if and when you start drawing Social Security, then they will automatically deduct it monthly. Part B of Medicare, it helps cover your medically necessary doctor services, outpatient care, tests, durable medical equipment, limited home health care, preventive services, and more. Unfortunately, those that are higher income Medicare beneficiaries will pay more for Part B of Medicare. Social Security, they look at your income on your tax returns, and they look at your modified adjusted gross from 2 years ago. So for the year 2020, they look at your 18 tax return. And if your individual tax return was less than $87,000 in the year 2018, or those that file a joint tax return and the income was less than $174,000, you'll pay the standard Medicare Part B premiums. If your income 2 years ago was higher than that, your Medicare Part B premium will be higher based on that year's income. It's called IRMA, which is the acronym for Income Related Monthly Adjustment Amount. And the different levels that you can pay are there on your screen and for you to study. And your Medicare premiums can go up or down each year based upon your filings. Social Security will audit it every year, and they'll look at your modified adjusted gross of the year, 2 years previously. So for the year 2021, look at your 19 tax return and so forth. Obviously, if you're working 2 years previously before going on Medicare, and if you go on Medicare and your income has gone dramatically down, you can actually appeal to Social Security, give them a call and discuss your current income situation with them. And if it's gone dramatically down, they may lower your Medicare premiums based on your current status. Otherwise, they'll audit it every year. So enrolling into Medicare. Medicare usually starts on the first day of the month that you turn age 65, unless your birthday falls on the first, then they actually backdate it a month. If you're receiving Social Security or railroad retirement benefits, you'll actually get your Medicare card automatically in the mail 3 months before you turn 65, or the 25th month of receiving disability benefits. If you're in this situations and you do not receive your Medicare card in the mail, you'll want to contact Social Security, and the number's there on your screen. And currently they're open Monday through Friday from 8 to 5:30 Pacific time, and they're one of the better government agencies to deal with. They're very knowledgeable, very friendly, and usually very helpful. If you're not receiving Social Security or railroad retirement benefits, you actually must sign up for your Medicare through Social Security. To enroll, you can do it. Probably the easiest way is online. You can go to ssa.gov, the Social Security website, and on that home page in the middle to the bottom right, there is a tab you can click on that says Medicare Enrollment. You click on that, and the next screen you'll scroll down to Medicare Enrollment, and you click on that and follow the steps. It's a pretty straightforward process. It takes about 10 or 15 minutes. Otherwise, you can call them to enroll, and they'll set up a future telephone appointment with you on the phone. You used to be able to go into the office, but unfortunately they're not open currently, so you can do it one of those two ways currently. So enrolling into Medicare, they have an initial enrollment period for Medicare. You may sign up for Medicare 3 months before the month you turn age 65, which includes your birthday month, up to 3 months after your birthday month. So it's a 7-month window. You can enroll 3 months before your eligibility, the month that you turn 65, up to 3 months after. If you sign up within 3 months before your birthday month, Medicare will start on the first day of your birthday month, unless your birthday falls on the first, then they'll backdate it. If you sign up during your birthday month, within 3 months after your birthday month, Medicare will start 1 to 3 months after signing up. If you miss your initial enrollment period, there is a general enrollment period each year for enrolling into Medicare, and this occurs every January 1st through March 31st. And if you sign up during this time frame, coverage will start July 1st, and you may incur a late enrollment penalty. So those that are covered by an employer-sponsored group health plan, and it's based on current employment with 20 or more employees, you can actually delay signing up for Medicare Parts A and or B with no penalty. However, when employment ends or group coverage ends, whichever happens first, you have an 8-month window to sign up for Medicare Parts A and or Part B with no penalty. So again, if you're working covered under employee-sponsored group health coverage, or you're the spouse covered under your husband or wife's employee coverage, and there's more than 20 employees, you both can delay signing up for Medicare Part A and or Part B until either the insurance ends or the group coverage ends, whichever happens first, and you will not have a penalty. And as we mentioned on the next slide, if you sign up for Part A of Medicare only and there's more than 20 employees, you can sign up for Part B in the future when such time is necessary. And you will have 8 months to enroll into Part B once employment ends or group insurance ends, whichever happens first. Most people are going to coordinate their Part B insurance for Medicare to start once the employment or the group insurance ends, but if you happen to miss that particular enrollment, you have that grace period to do so. And the rule of thumb is that if you're working or your spouse is working and you or them are covered under the group insurance and there's more than 20 employees, you can delay signing up for Medicare Part A and or Part B with no penalty. If there's less than 20 employees and you're covered under the group insurance and Medicare eligible, usually Medicare becomes primary, and you're going to want to enroll at that time to avoid any penalty or any effect on your group insurance. So if there's less than 20 employees, generally you're going to want to enroll into Medicare Parts A and Part B because Medicare becomes primary at that point. Always check with your human resource or benefits advisor to see how Medicare coordinates with your group insurance. So as we mentioned, if you sign up for Part A of Medicare when you're still working covering the group insurance and there's more than 20 employees, you can delay signing up for Part B. Most people will take Part A because there's no premium for it and delay Part B because there is a premium. And if you enroll and you're still covering the group insurance, you'll be paying for Part B for no particular reason. So if you're working covered under group insurance, you can sign up for Part A and delay your Part B with no penalty until such time as necessary. And if you want to enroll into Part B into the future and you have Part A only, there'll be 2 forms that need to be completed. One you fill out, one you and your employer fills out, and then you submit those to Social Security, and then they enroll you into Part B when such time is necessary. We have those forms in our office, or you can get those on Social Security's website. So if you're covered under group employees coverage and you do have a health savings account contribution, this is one time you will want to delay both Parts A and Part B of Medicare. If you have a health savings account contribution and you're still working covered in the group insurance, or there's more than 20 employees, if you sign up for Part A, it could have an effect on your health savings account. But again, always check with your human resource or benefits advisor to see how it coordinates with the group insurance. If you don't have any health savings account contribution and you're eligible for Medicare, you can go ahead and sign up for Part A and then delay Part B until such time as necessary. So those that are covered by COBRA, this is kind of a tricky one. COBRA is a continuation of group insurance once employment has ended. And it meets one of the 2 criteria, either group insurance ends or employment ends. And if you are eligible for COBRA and you're Medicare eligible, you have 8 months to sign up for Medicare once employment ends with no penalty. COBRA can run a period of 18 to 36 months. So if you're going to stay on COBRA and you become eligible for Medicare, make sure you enroll into Medicare Part A and Part B so you don't get penalized. And it's always a good idea to compare COBRA, what you're going to be paying for it, and their benefits, because it can be expensive at times compared to the individual plans if it's eligible for you. But again, if you're on COBRA and you're eligible for Medicare, make sure you enroll into Medicare within 8 months so you can avoid that penalty. So now we're going to talk about the 2 main plan choices for Medicare coverage. If you're enrolled into Medicare A and B and going to enroll into an individual type of plan, you will enroll into one of either types of these 2 plan choices. Either a Medicare Advantage plan, which can be an HMO or Medicare Advantage PPO. With the Medicare Advantage plans here in Orange County, most of them have a 0 premium, and there's a couple plans that have a very low premium. And the Part D drug coverage is incorporated into the benefits, so you do not need a separate policy. The other type of plan choice we'll be talking about today is the Medicare supplements, also known as Medigap. With the Medicare supplements or Medigap, you actually do pay a monthly premium for the coverage. And the Part D drug coverage is not included, so you do need to enroll in a separate Part D drug plan for your prescription coverage. And to enroll in either a Medicare Advantage or a Medicare supplement, you must be enrolled into Medicare Parts A and Part B. So we're going to discuss the Medicare Advantage plans first, and it can be a Medicare Advantage HMO or Medicare Advantage PPO. The Medicare Advantage plans are also known as Medicare Part C. Medicare Advantage plans combine Medicare Parts A and Part B and the Medicare Part D drug coverage into one plan. Most plans include extra coverage like vision and hearing, and most of the plans now have dental in the policies, and comprehensive dental can be optional. With the Medicare Advantage plans, HMO or PPO, each Medicare Advantage plans has different costs, co-payments, co-insurance, and out-of-pocket yearly maximums that you pay before they cover you 100%. And the drug coverage is included in the benefits. Prior authorization is required for certain services. The plans do provide worldwide coverage for emergency and urgent needed services, and the benefits for the Advantage plans can change every single year. So with the Medicare Advantage HMO plans, you must get your care from the plan's network of providers and hospitals, except for emergency or urgent care situations. With the Medicare Advantage HMOs, you select a hospital, a medical group, and primary care physician from the plans, network providers in your service area. And referrals are required to see specialists. So with the Medicare Advantage plans, the insurance companies, like the umbrellas, they provide the medical benefits. And then there's many, many different medical groups that contract with the Advantage plans. And depending on what hospital and doctors you want an association with will dictate what medical group you choose your primary doctor from. So to make sure you receive all your services through Hoag Hospital, Hoag Facilities, Hoag Urgent Cares, Hoag doctors and specialists, you would want to choose your primary doctor from the Hoag Medical Group. And again, that way it'll make sure you receive all your medical services through Hoag Hospital, Hoag Facilities, Hoag doctors, and Hoag specialists. And again, referrals are required from your primary doctor to see the specialist within your medical group. With the Medicare Advantage plans, as we mentioned, here in Orange County, most plans have a 0 or very, very low monthly premium. You always have Part A and must be in Part B and paying your Part B premiums. And then with the Advantage HMO plans, you'll have co-payments or co-insurance for authorized services received in-network or out-of-service providers. If you refer yourself out of the network for non-authorized services, except for emergency care and urgent care, unfortunately, you'll be liable for the cost. So when you have a Medicare Advantage plan, make sure you get a referral to see the specialists. The Part D drug coverage with the Advantage HMOs are included in the drug plans, so you do not need a separate policy. So as we mentioned, the Medicare Advantage plans can be a Medicare Advantage or Medicare Advantage HMO or Medicare Advantage PPO. With the Medicare Advantage PPO, you can use in-network plan providers or actually self-refer out of the network to providers that agree to accept the plan. Referrals are not required to see specialists, and you do pay a monthly premium for the PPO Advantage plans. And then you'll have deductibles, co-payments, and co-insurance, and out-of-pocket maximums that you pay before they cover 100% for authorized services received in or out of network. If you self-refer out of the network, you generally will have higher co-payments, co-insurances, and out-of-pocket maximums for out-of-network providers. And then the Part D drug coverage is included into the plan. So the other type of coverage we're going to discuss in lieu of the Medicare Advantage plans would be the Medicare supplements, also known as Medigap. With the Medicare supplements or Medigap plans, they supplement original Medicare and pay secondary to Medicare. With the Medicare supplements or Medigap, you can choose any doctor, any specialist, any hospital nationwide that takes Medicare patients. Referrals are not needed to see specialists, and prior authorization and approvals are not required. Currently, there's 10 standardized plans that you can choose from, and if you're new to Medicare Part A as of January 1st of this year, there's a couple plans, unfortunately, that you're not eligible for, which are considered Plan F, F Extra, or Plan C. But don't be alarmed, because there is Plan G, which is very close in benefits to Plan F. So with the Medicare supplement plans, different companies will charge different premiums for the same standardized Medicare supplement plan. So any companies that offer Plan G, Plan N, etc., the benefits are identical. You can access all the same doctors, and they all pay the same claims. It's just different companies offer different premiums for the same standardized Medicare supplement plans. And obviously you do pay a monthly premium for the Medicare supplements, and always enrolled in Part B and enrolled in Part A and paying your Part B premiums. Unfortunately, the Part D drug coverage is not included with the Medicare supplement plans. You actually must buy a standalone Part D drug plan to go along with your Medicare supplements. The Medicare supplements or Medigap plans are what they call guaranteed renewal for life. They can never change the benefits of the plan or cancel the plan other than non-payment of premium. And unfortunately, the premiums do go up with attained age. So now we're going to discuss the Medicare Part D prescription drug coverage. Medicare Part D drug coverage is available to anyone that has Medicare Part A and or Part B. Medicare itself does not sell the Part D drug plans. To get a Medicare Part D drug coverage, you actually must enroll in a plan. And there are two ways to get your Medicare Part D drug coverage. One is to buy a standalone Medicare Part D drug coverage to go along with your Medigap or Medicare supplement. And the Part D drug plans are sold by various Medicare approved companies. The other way you can get your Part D drug coverage is enroll into a Medicare Advantage HMO or PPO that includes the Medicare Part D drug coverage in the plan. The Medicare Part D plans have what they call formulary and drug tiers. Each Part D drug plan has a different list of drugs that it covers called a formulary. And the plans will place the drugs into different formulary tiers. From tiers 1, they can have up to 5 or 6 tiers. And each tier has different co-payments and co-insurance amounts that you will pay. The lower the tier, the lower the copay. So for instance, a tier 1 can be considered a preferred generic, which would be the lowest copay. A tier 2 could be considered a generic drug. Tier 3 would be considered a preferred brand drug. Tier 4 can be classified as a non-preferred medication. And then Tier 5 and Tier 6 can be considered specialty and high-cost injectable drugs. And the Part D drug plans, they all have the same coverage model, and it's a little bit confusing how they came up with this coverage model. But all the plans have this particular coverage model. You cannot get away from it. The plans can have 4 stages. They do have 4 stages. Some plans do include a deductible, and some plans do not have a deductible. So if your plan does have a deductible, generally you'll pay the full cost for drugs, except for generics, until you've paid the $435 deductible. And if you have no deductible, or generic drugs only, or have met the deductible, then you go into the next stage, which is considered the initial coverage stage. And then you'll pay the formulary tier co-payments or co-insurance for your drugs until the full cost of your medications, the retail costs, exceed $4,020. If the full cost of medications exceed $4,020, again, not what you pay, but the actual retail cost of medications this calendar year exceed $4,020, then you go into the next coverage stage, also known as the coverage gap or the donut hole. And in the coverage gap or the donut hole, typically this year you will pay 25% of the retail cost for generic drugs or 25% of the cost of brand drugs until you reach the coverage gap limit, which is $6,350. If you exceed that, then you go into the next coverage stage, also known as the catastrophic stage. And in the catastrophic stage, this calendar year, if you enter that, you will pay $360 for generics, $895 for brand, or 5%, whichever is greater, until the calendar year ends. And then, unfortunately, it resets and you start back at the beginning next year. The drug companies will send you a statement each month where you're at in the different stages. And generally in the end of September, maybe the beginning of October, they will send you an annual notice of change for the upcoming year to see how your plan changes. So let me back up a slide. So what contributes towards the coverage gap limit of $6,350 is any deductibles you pay, any co-payments you pay in the initial coverage stage contribute towards that coverage gap limit of $6,350. And when your coverage gap, the 25% of the cost of generics contribute towards that $6,350 out of pocket. And for brand drugs, for most brand medications, the 25% you pay contribute towards that. And the manufacturer will pay 75% of the retail costs in the coverage gap towards that $6,350. So fortunately, you don't pay the full $6,350 out of pocket to get into the catastrophic stage. You pay a good chunk of it, but fortunately, there is contributions by the manufacturer towards that figure. So what you pay in stage 1, stage 2, and stage 3, and what the manufacturer contributes towards brand drugs in the coverage gap contribute towards that $6,350. If it's exceeded, then you go into the catastrophic coverage stage. And again, once you're in the catastrophic stage, you pay $360 for generic, $895 for brand, or 5%, whichever is greater. As far as the standalone Part D drug plans, there are 32 different drug plans you can choose from. And they all have different premiums, different formularies, different co-payments. And how we make recommendations for the drug plans, whether it's an individual drug plan or for the Advantage plans, is we input one's medications and then we get a line-by-line itemization of all the drug plans and list them from which drug plan is least out of pocket to which is highest, and that's how we make recommendations for the drug plans for the Part D and the individual and for the Advantage plans. If someone's not taking medications, then we just recommend one of the lower cost premium plans so you have the coverage in case you need it and don't get penalized, which we'll get into a little bit more later. So the drug coverage can be confusing, but all the drug plans, whether it's an individual drug plan or the drug plan with the Advantage plans, all have the same coverage model. And unfortunately, those that are higher income Medicare beneficiaries that pay more for your Part B, you will also pay more for your Part D. They shake the trees any way they can. So again, if your income is for individuals on your modified adjusted gross 2 years ago is greater than $87,000 for an individual tax return or $174 for a joint tax return, you will pay more for your Part B as well as your Part D drug coverage. Again, it's called the IRMA or income related monthly adjustment amount. And the different levels that you can pay are up on your screen for you to study. And again, they audit it every single year. So your Medicare Part B and Part D premiums can go up or down based upon your filings. And we mentioned briefly that you can have what's called a late enrollment penalty for Part D. If you delay enrolling into Part D or have a break in continuous drug coverage for 63 days or more, and you don't have what they call creditable coverage or extra help, when you enroll in the future, a late enrollment penalty will be added to your Part D premium for life. It's not a huge penalty, it's more of a nuisance, but it will be tacked on for life. And the penalty is 1% of the national base premium multiplied by the number of uncovered months. So for instance, let's say you went 24 months without drug coverage. The average national base premium is around $35, so your penalty would be 24% of $35, which is around $8 and change, and that will be tacked on to your premium for life. And we always recommend enrolling to some type of drug coverage so you have it in case you need it and don't get penalized later on for enrolling late. So there's a program called Extra Help, and this helps people with limited income resources pay for Medicare drug costs. It's also called Limited Income Subsidy. It can help pay your monthly plan premiums, deductibles, co-insurance, and co-payments. If you think you qualify for this, give Social Security a call and discuss your income with them, and you may qualify for the low income subsidy or Extra Help. So now we're going to discuss the varied enrollment timeframes into the plans. There is an initial election period, turning 65 or new to Medicare. There is a special election period based on different scenarios, such as leaving employer group plans, a permanent move, 12-month trial basis. The annual election period, which you've probably seen before advertised, and we're getting into that period shortly. It occurs every October 15th through December 7th. And it's for Medicare Advantage and Part D drug plans only. And then there's a relatively new one called a Medicare Advantage Open Enrollment Period, which occurs for existing Medicare Advantage plan members only. So the initial election or enrollment period for turning 65 or new to Medicare, and you are wanting to enroll into a Medicare Supplement Medigap. You have guaranteed issue where they cannot ask any health questions for a period of 3 months before your eligibility for Part A and Part B of Medicare, up to 6 months after your Part B of Medicare goes into effect. The initial election enrollment Medicare period for Advantage plans, you may enroll into an Advantage plan 3 months before your Medicare eligibility, up to 3 months after you turn age 65 with no health questions. Well, this year they actually do ask one health question, and that's if you have end-stage renal disease. Now, in the past, if you have that condition, unfortunately, you cannot roll into a Medicare Advantage plan. Next year, they're doing away with that one question, so there will be no health questions for the Advantage plans at any time next year. And for the Part D drug coverage, you can enroll into a Part D drug plan 3 months before your Medicare Part A and a Part B goes into effect, whichever's first, or 3 months after your Part A or Part B goes into effect, and there are no health questions for the drug plans. And then there are special election periods to enroll into the plans. Those that are leaving employer-sponsored group health plans and you would like to enroll in a Medicare Supplement Medigap, you have guaranteed issue, no health questions can be asked for the Medicare Supplement plans for a period of 63 days after your group plan ends. Unless you're new to Part B of Medicare, then you have 6 months. And again, most people are going to coordinate their new insurance to start the day after your group insurance terminates. But again, if you do happen to miss that, you have these windows to enroll with guaranteed issue and no health questions. And to be eligible to enroll in a Medicare supplement, you must have Part A and be enrolled into Part B of Medicare. So those that are leaving employer-sponsored group health plans and want to enroll into a Medicare Advantage HMO or PPO, instead of 63 days, you have 2 months to enroll in a Medicare Advantage HMO or PPO. And just like the supplements, you must have Medicare Part A and be enrolled into Part B to enroll into a Medicare Advantage plan. For the Part D drug plans, if you're leaving employer-sponsored group health coverage and you want to enroll into an individual Part D drug plan, you have 2 months after the group plan ends to enroll. And to have enrollment into a Part D drug plan, you must have Part A and or Part B. So there are other enrollment periods, special election periods, to enroll into the plans. The Medicare Advantage plans have trial basis. If you're turning 65 and new to Medicare, and you enroll into a Medicare plan initially, they will give you a 12-month trial basis, try the Medicare Advantage plan out. If for any reason you're not happy with the Advantage plan, or you simply want to enroll into a Medicare supplement for whatever reason, they'll give you a special enrollment period to terminate the Advantage plan anytime during the initial 12 months and enroll into a Medicare supplement, no health questions, and a drug plan. If you have a Medicare supplement plan and then in the future the premiums become cost prohibitive and the Advantage plans look attractive because of very good benefits, anybody who comes out of a Medicare supplement and enrolls into a Medicare Advantage plan for the very first time, they will give you 12 months to try the Advantage plan out. And if for any reason during the initial 12 months you're not happy with the Advantage plan, or you simply want to get your Medicare supplement back for whatever reason, you can terminate the Advantage plan anytime during the initial 12 months and get your Medicare supplement back with no health questions. Unfortunately, they don't give you both enrollment scenarios. They give you either one, but it's nice that they have these trial right bases. There are other enrollment scenarios where you do not have to answer health questions, and it's not in your slides. One that's very popular, and we get a lot of questions on this, is that if you have a Medicare supplement plan in force and you want to switch your Medicare supplement and your initial window of 6 months being new to Medicare Part B has ended, you can actually switch your Medicare supplement anytime during the year if you can answer health questions no. But if you have health conditions or later on develop health conditions and you want to switch to a different supplement and company Z is a more attractive premium, every year during your birthday, if you have a Medicare supplement in force, you have a 30-day window before your birthday, up to 60 days after, to where you can switch your supplement to a different company or the same company that has equal or lesser coverage, no health questions. So again, if you have a Medicare supplement and you have health conditions or later on develop them and company B has a more attractive premium, you can always switch during your birthday anniversary, every anniversary, to a plan that has equal or lesser coverage with no health questions. Or if you move out of the plan service area, then you have a window of guaranteed issue to enroll in the supplement or a Medicare Advantage plan. So this is approaching very soon here. This is considered the annual election or enrollment period. This occurs every October 15th through December 7th. We get real busy in our office reviewing our clients' medications and Advantage plans for the upcoming year. The Medicare beneficiaries can join, switch, or drop a Medicare Advantage plan or Part D prescription drug plan during this time frame. This does not apply to Medicare supplement plans. Again, you can enroll switch or drop a Medicare Advantage plan or standalone Part D drug plan during this time frame. You must have Medicare Parts A and or Part B for the Advantage plans and Medicare Part A or Part B for the drug plans. And if you make a switch during this time frame, the new plan comes into effect January 1st and or cancels your plan out January 1st. And if you have a drug plan or an Advantage plan, we highly recommend reviewing your benefits and drug coverage every year, because unfortunately the drug coverage benefits change every single year, and whether your medications change or not, it's always a good idea to have an analysis done for your drug coverage to see who will cover them more cost effectively for the upcoming year. And this one's relatively new. It is a Medicare Advantage open enrollment period. And this occurs for existing Medicare Advantage plan members only. If you're enrolled in a Medicare Advantage plan, you can switch your Medicare Advantage plan during October 15th or December 7th, or you can switch it during this time frame, January 1st through March 31st. It's not widely known because they cannot advertise this or target anybody. But if you go to the pharmacy in January and you didn't analyze your drug coverage for the Advantage plan and your copay has gone up extremely, you can switch your Advantage plan during this time frame once. So if you have an Advantage plan, you can switch your Advantage plan again January 1st through March 31st once, and if you make a change during this time frame, the new plan becomes effective the following month. You can also disenroll from a Medicare Advantage plan during this time frame and then return to original Medicare Parts A and Part B and enroll in a Medicare Part D drug coverage and apply for a Medicare supplement or Medigap during this time frame. If you're going to use this window to enroll into a Medicare supplement plan, we highly recommend applying for the Medicare supplement plan first, because you may be subject to health questions and they may turn you down based on health. We don't ever want to leave anybody without health insurance. And if you use this enrollment period to go back on original Medicare and apply for a supplement, make sure you apply for the supplement first and get issued, because if you enroll into a Part D drug plan, it will automatically cancel out your coverage the following month. And we don't, again, ever want to leave anybody out of health insurance. So again, make sure you apply for the Medicare supplement if you do not have a guaranteed issue. Get issued by the Medicare supplement first, and then enroll to a Part D drug plan, which will cancel out your Advantage plan the following year. So I know we went over a lot of information. I will be here for questions now, and always can contact us at my office, and the program will be up online for future reference. So we will be taking questions now.
Okay, so the first question is, why don't you want to sign up for Medicare Part A if you have an HSA? She actually missed that part. Please repeat that.
Yeah, I'm not exactly sure on the workings on why that an HSA contribution by your employer can be affected by Medicare. I believe it has to do with your taxes. It can have some tax implications, which is my understanding. So if you have a Medicare, if you're eligible for Part B of Medicare, or Part A, and you're covered under group insurance and there's more than 20 employees and there's an HSA contribution, most likely you're going to want to delay your HSA because it can have an effect on the HSA contributions. And always check with your human resource or benefits advisor.
The next question is, for HMOs, what if you end up relocating in another state years later?
Yeah, that's a good question we get often, is that if you have a Medicare Advantage HMO or PPO and you move to a different state, what happens then? Well, the Medicare Advantage plan's benefits are really county to county. So even if you moved counties in California, you may need to enroll into a different plan because the counties have different plans available, different benefits available. And if you move to a different state or a different county, you will have guaranteed issue. There will be no health questions to switch to either a Medicare Advantage that's offered in that area, or you can go on to a Medicare supplement, no health questions.
Next question is, does Medicare Advantage HMO or PPO include all tier formularies 1 through 6?
So the question is, do the Medicare Advantage plans have the tiers 1 through 6 of the formularies? Yeah, all the Medicare Advantage plans that have the drug coverage or the individual Part D drug coverage will have the formulary tiers. Some have 1 through 5, some have 1 through 6. But each Medicare plan that offers drug coverage will have different formularies. They do not all offer the same drug coverage. That's why it's always a good idea if you're initially enrolling to a plan, whether it's an Advantage plan that has the drug coverage or standalone Part D drug coverage, to review the different plans to see how they'll cover your specific medications in their formularies. And then every year, as you mentioned, we can't stress enough how it's a good idea to review that coverage each year during the annual enrollment period, which we're shortly coming up into.
If I choose Medicare Advantage, which includes Part D, will I still need to pay the yearly deductible of $435 and the $4,020 co-payments and co-insurance?
So the question is, if you enroll into a Medicare Advantage that has the Part D drug coverage, are you subject to the deductibles and the IRMA for the initial coverage level of $4,020? Unfortunately, there's no way around the coverage model. Whether it's an individual Part D drug plan that you purchase to go along with the supplement, or the Part D drug coverage with the Advantage plans, they all have those 4 coverage stages. Stage 1 can be the deductible. Not all plans have a deductible, some do. Most of the Advantage plans do not have a deductible, but if you do have a Part D drug plan, no matter what type of plan you enroll with, you are subject to the initial coverage limit of $4,020 of retail costs before you go into the coverage gap. And unfortunately, there's just no way around that. And all Part D drug coverage, whether it's a standalone drug plan or those that are connected with an Advantage plan, all have those 4 stages.
My employer provides health coverage after we retire. I am still working at age 68. When I retire, can I use my employer health insurance as my primary and Medicare as my secondary?
So the question is that they have group coverage and they're still employed at age 68. And in the future, if when they retire, will my group insurance be primary and the Medicare be secondary? Generally, no. If you employment ends or group insurance ends, then you have 8 months to enroll into Part B with no penalty. And generally, Medicare is going to become primary. I mean, there's exceptions to every rule, so always check with your benefits advisor, human resource. But usually, Medicare will become primary. If there's more than 20 employees, you're still employed, and then employment ends. So yeah, most likely you will have to enroll into Medicare Part A and or Part B at that time.
The next question is, my employer-based coverage is from my husband's employer. He will continue working. Do I just need a termination of my coverage, not of his employment?
The question is that the spouse is covered under their spouse's employment coverage. The spouse is still working. And I'm sorry, can you repeat the last part of that question again?
So yeah, the spouse is still working. He's going to continue working.
Okay.
Does she need to terminate her coverage of his employment?
Well, I'm not sure if I'll answer this correctly, but if not, you can always contact me. Generally, if you're the spouse covering under your the primary's insurance and they're still working, you can delay your Medicare Part A and or Part B until such time as necessary. If you have Part A only and your spouse is working and you're the dependent, you can delay Part B until either the insurance ends or the group insurance or the employment ends, and then you'll have 8 months to enroll into Part B with no penalty. I'm not sure if I'm answering that correctly, but if you have Part A and then in the future you need to enroll into Part B when such time is necessary, there'll be 2 forms that you would fill out. One you would fill out, and then one you and your husband and his employer would fill out, and then you submit those to Social Security, and they enroll into Part B at that time. If I didn't answer or get the full question answered for you, please contact me at a later date.
The next question is, why do you pay for Part B if you have an Advantage plan?
The question is, why do you pay for Part B of Medicare if you have an Advantage plan? That is a requirement to join an Advantage plan or a Medicare supplement. You must have Part A enrolled into Part B and paying your premiums for Part B to be eligible to enroll into an Advantage plan or a Medicare supplement plan. I know most of the Advantage plans don't have a monthly premium in addition to what you pay for your Medicare Part B. But unfortunately, whether the Advantage plan has a premium or not, you still need to be enrolled in Part A and enrolled in Part B and paying your premiums for Part B.
Under Advantage PPO, can we go outside of the county facilities that accept, for example, if you had insurance, Blue Cross, that accept Blue Cross?
The question is, can you go outside of the network with your Medicare Advantage PPO? Yeah, you can. You can self-refer to providers that are out of your network that agree to accept the Medicare Advantage PPO. So yes, you can self-refer, but not all doctors take Medicare will take the Medicare Advantage PPO, unlike a Medicare supplement. The Medicare Advantage PPOs used to be popular. They're not nearly as popular than they used to be years ago. They have a pretty sizable out-of-pocket that you pay before they cover you 100%. So if you're thinking about enrolling in a Medicare Advantage PPO, compare what you pay for the Medicare Advantage PPO, the deductibles and co-payments to a Medicare supplement. The Medicare supplements will be better coverage, less co-payments, and very near the same premium. So always compare the supplements to a Medicare Advantage PPO. But yeah, you can self-refer out of the network if the provider agrees to accept the plan.
Will they ask health questions if you don't start using Medicare until 68?
The question is, will they answer health questions? And I believe you're referring to enrolling into Medicare. If you're covered under group insurance and there's more than 20 employees and you delay Medicare A and B, no, there's no health questions to enroll into Medicare. And if you're covered under group employment and your Medicare A and B has been in effect for some time and you want to enroll in a supplement or an Advantage plan, they won't ask questions for the supplements coming off group insurance for a period of 63 days. And for the Advantage plans, they won't ask any health questions for a period of 63 days coming off group insurance. But if you're enrolling into Medicare at a future date coming off group insurance, there's more than 20 employees, there's no health questions to enroll into Medicare.
Can you choose a different Part D plan every year?
Yeah, that's a good question. Can you choose a different Part D drug plan every year? Yeah, you can. And usually one will enroll into a different Part D drug plan because the benefits for the Advantage plans, drug coverage, and the individual Part D drug plans can change every single year, and they usually do. And whether your medications change or not, it's always a good idea to review the drug coverage for the upcoming year, or have us review them, or have someone that review them for you, because whatever drug plan you have, whether it's an Advantage plan or a standalone Part D drug plan, the benefits for the plans change every single year, and you do have an opportunity to change that once a year during the annual enrollment period, which is every October 15th through December 7th. If a new plan is enrolled during that time frame, the new plan becomes effective January 1st and will cancel out your existing plan automatically January 1st for the Advantage plans or the drug plans.
I think you answered this, but if you would like to reiterate, is Medicare Advantage PPO better than supplement?
Is Medicare Advantage PPO better than a Medicare supplement? The Medicare Advantage PPOs used to be popular years ago, but they have pretty sizable deductibles and co-payments that you pay out of pocket before they cover you 100% compared to a Medicare supplement plan, which can have very similar premiums. So yeah, always review the benefits for the Medicare Advantage PPOs versus a Medicare supplement or Medigap plan, and you'd be surprised at the difference in the out-of-pockets that you pay for the coverage. But generally, the Medicare Advantage PPO plans here are not very popular, and you may want to look into a Medicare supplement plan versus a Medicare Advantage PPO plan.
What are the general pros and cons between Medicare Advantage plans and Medigap?
Yeah, we get this a lot. What are the advantages between an Advantage plan and a Medicare supplement, or which plan is better for me? The Advantage plans are very attractive. Most the HMOs here in Orange County, most of them have a zero premium, and then the drug coverage is in the benefits. And for most services, you'll have a zero copayment. And the out-of-pocket maximums, the most you pay in a calendar year for your medical services, are very low. And they have usually extra benefits that most of the supplements do not cover, like routine vision, hearing benefits, transportation, dental, etc. They're just a little more restrictive on how you can access the providers, because you are limited with the Medicare Advantage HMOs to a particular medical group, and you have a primary doctor that you see for all medical services, and then the primary doctor refer you to the specialty in their medical group. They work very, very well. They're just more restrictive. Those that are used to self-referring want to retain that, or you may have a lot of doctors and specialists that may not belong to a medical group, and you want to keep those specialists, or they may be spread out through many different medical groups and they'd be very hard to navigate. Gravitate towards a Medicare supplement plan. They both work very well. You have more freedom with the supplements, and the Advantage plans work very well, especially here with Hoag and the Hoag Medical Group. And there's no premium, and most of the co-payments for your services will be zero. The out-of-pocket maximums are low. The drug coverage in the benefits, unlike the supplements, where you have to have 3 premiums. You have a premium for your supplement, you have a premium for your Medicare, and you have a premium for a drug plan. With the Advantage plan HMOs, typically you're just going to pay your Medicare premiums and no additional premium for the medical coverage and the drug coverage. They both work very well. They just work a little bit differently.
If I choose a Medicare Advantage, which includes Part D, will I still need to pay a yearly deductible of $435 and the 4,020 co-payments and co-insurance?
Yeah, the question is, if I have a Medicare Advantage plan, do the various stages, the deductibles, the initial coverage limit of 4,020, the coverage gap limit, and the catastrophic coverage plan apply to me? Yes. Unfortunately, there's no way around that. All the Part D drug plans, whether they're standalone that you purchase with a Medicare supplement, or those that are integrated into the Benefits Advantage plan, have those 4 stages. Not all plans have a deductible, but if there is one, you will be subject to it, and you will be subject to the various other stages and the different thresholds. So unfortunately, yes, you would be subject to those.
Next year, I will enroll in Medicare A and B and pick a supplement plan. Is there a chance I will get a separate bill from the MD for any costs?
The question is, next year I'll be eligible for Medicare and going to be enrolling into a Medicare supplement plan. Will I be getting any surprise bills from the providers in the future? You may. For any Medicare approved charge, let's take Plan G, for instance. That's going to be the highest coverage available to you next year. There is currently a $198 deductible that you pay, and then after the deductible's met, they cover 100% for a Medicare approved charge. If it's a non-Medicare approved charge, unfortunately, you'll be liable for that, but Medicare does cover most services, and it's highly unlikely that there'll be any surprises, but you would be subject to the deductible and anything that's not approved by Medicare.
Okay, the person that asked this question that I'm going to say is asking for further clarification, which is, why don't you want to sign up for Medicare Part A if you have an HSA?
The question is, why do you not want to enroll into Medicare Part A if you're covered in a group insurance and there's more than 20 employees? It can have an effect on your HSA contributions by your employer. I'm not sure the full workings of it, but it can have a detriment to it. My understanding is that it can be tax implications, and you don't want to enroll most likely into Part A if you have an HSA contribution by your employer. There's really most people, if they don't have an HSA, enroll in the Part A, but there's no coordination with their group insurance if you're still working, cover when they're more than 20 employees. So whether you enroll in the Part A or not, it's really not going to have any bearing on your insurance unless you have an HSA contribution, but it can have an effect on that.
Again, for further clarification, so if I continue to work past 65 and I have an employer group-based plan, I do not have to sign up for either A or B without any penalty as long as I sign up within 8 months of termination.
Yeah, the question is if I'm still working covered under group insurance, can I delay Part A and a Part B with no penalty up to a period of 8 months once my employment ends or once my group insurance ends? So yeah, the rule of thumb is if you're employed, covered under group insurance, and there's more than 20 employees, you can delay Medicare Parts A and or Part B with no penalty until, again, either employment ends or group insurance ends, whichever happens first. Then you have an 8-month window to roll into Medicare A and or B with no penalty. And again, most people are going to coordinate your Medicare A and B to start usually the day after your group insurance terminates, so there's no lapse in coverage. But if you do miss that window, you do have that opportunity of 8 months to enroll into Medicare Part A and a Part B with no penalty. If you're still employed under covered under group insurance and there's less than 20 employees, generally you're going to want to roll into Medicare Part A and Part B because Medicare Part A and Part B becomes primary if there's less than 20 employees. There's always exceptions to every rule, but always check with your human resource or benefits advisor to see how Medicare coordinates with your group insurance.
Do you have any advice for people who need very expensive cancer drugs?
The question is, do we have any advice for those that are taking very expensive cancer medications? A lot of the chemotherapy medications are, if you have a Medicare supplement, are covered under Part B and your supplement. There are some expensive chemotherapy and cancer medications that would fall under Part D, prescription drug coverage. And really the only way to have the least out-of-pocket expense is to review the different plans to see how they cover your specific medications. And with the Advantage plans, the medications under Part B and the supplement that we covered under that type of insurance, with the Medicare Advantage, you would have a co-payment of 20% of the cost of the medications up to your out-of-pocket maximums, worst case scenario with the Advantage plans. And fortunately with the Advantage plans, the out-of-pocket maximums are very low. Next year they'll be around between $7.99 up to $9.99. It can vary, it can be a little bit higher than that. But worst case scenario for your Part B chemotherapy or cancer medications that fall under Part B, you have an out-of-pocket maximum before they cover you 100%. And then there are instances where some of those high-cost medications may fall under Part D, and it's a good idea, again, to review the coverage to see how they're covered by the Advantage plans, Part D drug coverage, or the individual Part D drug plans that go along with the Medicare supplement plan.
And to piggyback on that, what about experimental cancer drugs that are not standard FDA approved?
So what about experimental and investigational medications that are not FDA approved? Generally, unfortunately, they will not be covered by the Advantage plans or the Part D drug coverage. They have to be formulary on the company's formularies, and generally, unfortunately, they most likely will not be covered.
So would you clarify that if Hoag offers an Advantage HMO?
Yeah, we get this a lot. Does Hoag offer Medicare Advantage plan insurance coverage? No, they do not. Hoag contracts with different Advantage plan companies, and if you enroll one of those contracted plan companies that are associated with Hoag, you want to make sure that you enroll with the Hoag Medical Group. Choose your primary doctor from the Hoag Medical Group and through the insurance companies, and that will ensure that you receive your services through Hoag, the Hoag physicians, and the Hoag specialists. But yeah, Hoag itself does not offer health insurance.
Where can we get the formulary information for the different plans?
Yeah, the question is, where can you get the formulary information for the plans? We can help you review that coverage in our office. We can input those, and we get a line-by-line itemization of all the different plans and list them from which plan is least out-of-pocket to highest. It's a general public website. We use Medicare's website, and obviously you have access to that, and that's what we do for our clients. We service them throughout the years, and as I mentioned, we get real busy during the annual enrollment period reviewing our clients' medications for the upcoming year. And if you're in our office or if we have a Zoom or on the telephone, we can review that coverage for you.
Don't you get Part A automatically through Social Security at age 65? Because you said you didn't have to sign up for it.
Do you get Part A automatically? If you are drawing Social Security or railroad retirement benefits, or have 25th month of disability, or have end-stage renal disease or Lou Gehrig's disease, you automatically get enrolled into Medicare. If you're not in those situations, you actually must enroll into Medicare Parts A and or Part B. And there'll be different enrollment timeframes for you to do that. But if you're receiving Social Security benefits, railroad retirement benefits, 25th month of disability benefits, Lou Gehrig's disease, or end-stage renal disease, then they will automatically enroll you into Medicare.
I think that's it.
All right, well, thank you. We really appreciate you joining us. If you have any further questions, need help, would like to contact us, please do. We counsel everybody in our office. We don't ever charge a fee. And the program will be up on the website if you'd like to reference it. And thank you for everybody, and have a great evening.